keeping cool? Yes, everybody's appreciated a little bit of rain yesterday and overnight. I missed it, but apparently we had some rain. But welcome to our Lost Count for 28 Empowered Senior Speaker Series. We're glad to have you all here today. Who is here for the first time? Always like to know if we've got any newbies. Wonderful, thank you so much, and welcome back to everyone else. And for the people who are here for the first time, we hope that you find the session today valuable, helpful, informative, and that we see you again in the months ahead. So for those who don't know me, my name is Meredith Joaquim. I'm a real estate broker here in Burlington, and I work primarily with older adults and your mind blues. And if you'd like to make faces up here. No, you're okay. Okay. So these sessions came to be just sort of through my experiences over the past couple of years in working with my clients and knowing that, recognizing that there's a lot of information that people are lacking. And although we are living in the era of instant access to information through the internet and all different sorts of places, you just never know what you can trust, who you can trust, and then go to get accurate information. So this, I can assure you, is a reliable source, and we have reliable educational partners here that you can reach out to and count on as you need. So just wanted to extend my thanks and appreciation and just acknowledge the educational partners who come together every month to help put these sessions on. It would be difficult to do it without them, and I very much appreciate their support and commitment to this, and we'll just let them introduce themselves.
I think I get to go first because I'm the shortest of the bunch. Hi everyone, I'm glad that we have such a full crowd today. So I'm going to actually ask the opposite of what Marion asked. Who's here for the 28th time? Awesome. Good job. Marion's done a fabulous job. So my name is Ela White. I'm a senior investment advisor and portfolio manager with Raymond James. But I also have a specialty in aging, dementia care, and patient navigation.
And Ela's been here 20 times.
Hello everybody, this is my first time, so I did raise my hand when the question was asked. My name is Sadie Novak, and I'm here today from Chartwell Retirement Residences. We have two great residences here in Burlington, both located on Lakeshore Road, but something that I really wanted to highlight today was Chartwell's Wish of a Lifetime program. And if you're ever wondering, or you've ever seen Chartwell Wish of a Lifetime, what is it? Well, it is a nomination program where we grant wishes for seniors. And that's seniors all across Canada. They don't have to be Chartwell residents. And you know, if you are looking to fulfill a lifelong dream, celebrate a passion, be reconnected with a loved one that's far away that you haven't seen in a long time, or commemorating public or military service, I would love to speak with you. If you have a friend, a family member that you'd like to nominate for a wish, I'd like to speak with you as well. So thank you so much for having us today.
Hi, I'm Sarah Sunnix. I'm a funeral director with Smith's Funeral Home. My specialty is pre-planning, so helping people plan ahead, trying to get things in order ahead of time before the need comes. And then I also help with Canada Pension benefits, a checklist for the executor, and just kind of help to the executor when their time comes as well. Yeah, I'm just really grateful. I walked over from Brant Street, so it was a little bit hot, but it's a great day. It's a lot nicer than it was the last couple of days. So looking forward to saying hi to everyone.
Hi, my name is Kelly. This is my colleague Jennifer. We're from Compassionate Care Collaborators. We are end-of-life doulas, so anything surrounding end-of-life issues, from pre-planning to maid companioning to grief support. We're here for all of that. We have some pamphlets and brochures. And we also have the October speaker spot, and we'll be talking about grief, how to support someone in grief, and how to maybe look after yourself a little bit better when you are in grief. So I hope to see some of you there as well.
Hi, I'm Lori Meyer. I am with Parkland and Castor. We are a lifestyles community. Basically, we support all the way to a supportive, meaning memory care, enriched care, palliative care, all the way down. So,
Hi, good afternoon. I'm Jeanette Bach. I'm with Fluid Senior Transitions, and I help you to, again, think about your aging journey and plan ahead and make a plan, both short-term, longer-term. I help people through crisis situations, when things have happened all of a sudden and you don't know what to do next, whether it be that you're in the hospital and you need to get out but you can't go home and you need to find somewhere to go. Or I also help with aging in place, so if you want to stay in your home, you can't do it without some planning. So you may want to speak with me to understand what sort of things and supports you may want to put into place. I do all of those things. I'm an elder care planner. So if in doubt, give me a shout.
Just before Malice speaks, actually, I meant to mention that we have a new educational partner this month through PG Consulting, so this is the time to meet Mala.
Yes, thank you so much, Marian. As mentioned, my name is Mala. I'm here from PG Counseling and Family Support. We're actually just located down the street in Village Square in downtown Burlington. We provide counseling and mental health support to anyone of any age, whether it's for yourself or even for your family. We have a team of about 20 therapists that work with a variety of concerns such as stress, anxiety, depression, life transitions, all that stuff. And we offer services in person at our offices. We also offer not just support if you're going through a challenge, but also if things are coming about to help prevent you from feeling super stressed or super anxious while you go through your transition. So we're very excited to be here as an educational partner.
Hello, I'm Elizabeth. I'm a registered nurse and clinical leader with Bayshore Home Health. So we use the neighborhood health teams model to deliver home care services. So what that means is we have PSWs, caregivers that can assist with personal care, any tasks around the house, but you also have a supportive team, including a registered nurse, to help with any other concerns and with the goals of aging in place. So, for example, a registered nurse can help if you have any health concerns. If you're not feeling well one day, you can give your team nurse a call. And I'm just happy to answer any questions you might have about home care, whether it's government home care, private home care. I can help answer any questions and direct to some resources. Thank you.
Good afternoon, everyone. My name is Kim Rutledge, and I'm a living consultant for Fieldgate Retirement Living in South Oakville. And we are a small community retirement home for independent living, ranging from studios to 2-bedroom types. And one thing Fieldgate takes great pride in is our education in our community. And I'm here today presenting some information for you to help you with thinking about proactive versus reactive decision-making in retirement living. So I have a takeaway here today for you, which might be very helpful in helping you in the decision-making. So thank you very much for being here today, and I look forward to speaking with you.
Well, thank you, everyone. Great to have you. I just also wanted to mention that there's a few educational partners that aren't here today. Senior Care Access, they're actually a silent partner, but they support me in my endeavors. Senior Care Access is a website that you can go to, and it has a full registry of retirement homes and senior living options as well. They provide training for anyone who's in the senior service industry. Also missing today is Jared Sia from Qualicare Burlington and Oakville, a home care company. And also, 360 Downsize, 363, yes, Downsize, sorry, we've got too many things on my mind. Irene Zioba, so it's a company that helps people in transition, so Jeanette can do the planning piece and help you figure out kind of those logistics, and Irene is someone that can help you with the actual move. We also have Hearing Well Matters, and Meredith is here today, and I will introduce her in just a few minutes. So again, thanks to all of you. And also, could be remiss if I didn't thank Ida and Lisa, always helping me getting things set up. Today we had a big scurry to get tables moved around and get the room set up properly, and I couldn't do it without you guys, so thank you so very much. your tables. Please use those to jot down any questions you have. We will have a question and answer period at the end of the presentation, so we just find that we have a better, more wholesome discussion then rather than kind of interrupting throughout. You have also on your table a list of all the educational partners, what they do, sort of summary, and contact information. Be sure to take that home. An evaluation form. We appreciate if you fill that out before you leave. Today's topic is on hearing well. If you can't hear well today, there's still a few spots in the front that you can make use of. But please do put up your hand if we're not speaking clearly enough or loud enough to project to the back of the room. Please do remember to turn your cell phones either off or silent, just so that we have fewer interruptions during the presentation. And just a reminder about the parking. So again, you don't need to pay parking at the machine, but when you do come in, we're asked to pay the $3 at the reception desk. If you haven't done that, please do that on your way out. Okay, so today, we're here to talk about hearing well means living well. And so it's hard. I lived through this myself with my husband, actually. So we've just gone through a phase where he ended up getting hearing aids. And what I've noticed is that the people who have some hearing challenges don't know it. They don't know what they're missing. And they're missing out on a whole lot of the conversation, a whole lot of what's going on. And the person with the hearing challenge has challenges as well, so it makes things a little bit more difficult for them. The simple pleasures of life are made much more enjoyable when you can hear well. It definitely improves the quality of life. And also today, just actually by going on the Hearing Well Matters website, I learned that August is Hearing Month, National Hearing Month. Did you know that? That's what it says on your website. So we all yeah. Okay, so today we have with us Meredith Joaquim, and she is with Hearing Well Matters, again, one of our educational partners. She's a hearing instrument specialist, and she's responsible for testing patients, selecting and fitting new hearing aids, as well as patient counseling. On a mission to improve each patient's communication with their friends and family, she's focused on improving interpersonal communication styles and creating an opportunity for better hearing. And prior to taking on her role at Hearing Well Matters, she gained experience in the hearing healthcare industry and patient-centered care as an administrative assistant at the Burlington Costco Wholesale Hearing Center. So, just ask you to help me welcome Meredith.
You can all hear my voice nice and clear all the way at the back. Perfect, wonderful. So like Marian said, my name is Meredith. I'm a hearing instrument specialist just up around the corner on Maple Avenue at Hearing Well Matters. And I'm here to talk to you about all things hearing and ears today. So this is kind of our overview of what we're gonna jump into today. I've got a video kind of explaining how sound travels through the hearing system. I'm going to go over our hearing system, the form and the function, hearing loss, common signs and symptoms of those, what's involved in a hearing test. If you've never had a hearing test before, it's not really something that we do regularly until we get a little older and our ears become a problem. So a little insight as to what that means and what we do, and then a little bit about tinnitus and treatment of hearing loss as well. So, are we going to use this one? Okay. Technology joke. No, this is today.
Ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower-pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest-pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
It's amazing.
It's pretty magical. Okay, so we just did a little bit of a journey through the ear, but this is a still picture, kind of separated into different colors there. So the orange on the left-hand side is our outer ear. I like to describe it as the things you can touch. So that pinna all the way on the outside, and then the first little bit of your ear canal right into the tympanic membrane, which is also known as our eardrum, in that pink section of the middle ear. So when they talked about the malleus, incus, and stapes, also known as the hammer, anvil, and stirrup bones, they are the 3 smallest bones in our body, and they are responsible for passing that sound from the eardrum to the inner ear. They also amplify that sound, and they are so small they can fit on the head of a dime. So teeny tiny, you've got 3 in one ear and 3 in the other ear. So we know that hearing loss is not the most attractive thing, but I think that it's really something to focus on making yourself better. So I've got this little cartoon, somebody getting new glasses, and their friend says, "Oh, you look smarter already." And then somebody said, "My doctor said I was having trouble hearing, so they gave me hearing aids." And then the person responding is like, "Oh, I'm sorry." And I don't think it needs to be shied away from. I think treating your hearing loss is preparing yourself better and allowing you to incorporate and participate in all the aspects of your life. So the stigma around hearing aids and treating hearing loss has come down, but unfortunately it still exists, and we're trying to kind of break through that. And it is more common than you think. So we've got it as the number 2 most common chronic disease in Ontario. Number 1 is that kidney disease. Been 54% of Canadians aged 40 to 79, like it says up there, have some high frequency hearing loss. And it's more common in adult men than adult women, typically due to noisy hobbies and potentially careers. We've got different types of hearing loss, which I'll dig into a little bit more later on. Sensory neural hearing loss, conductive hearing loss, and mixed hearing loss. It can be unilateral, so on one side, just one ear is affected, or bilateral, both ears are affected. And then they range in severity. So we've got mild, moderate, moderately severe, severe, and profound. When we talk about what causes our hearing losses, there's a lot of different factors. We know aging and noise do the same thing to our auditory system. It wears out those stereocilia that you saw bouncing around in the video, and makes it harder for us to pick up those high frequency sounds first. So age-related hearing loss is called presbycusis, and we lose those high frequencies first, so things become less clear. Like we saw in the video, the way that the cochlea, that spiral organ, is organized, we run those high frequencies through a lot more than those low frequencies, and that's why we tend to lose the high frequencies first and then the lows later on. Noise is toxic to our hearing system and can cause similar damage as aging, like I said, reducing our sensitivity, resulting in reduced clarity, things sound mumbly, and noise becomes a big factor. Noise in general is a low frequency phenomenon. So if you have a high frequency hearing loss, you're hearing noise, no problem, but you're missing clarity, which is kind of a double whammy there. And then there's also a genetic component. So it can be passed down from your parents and your grandparents, just like your amount of wax production, your ear size, or your ear shape. So this is a big one. I've got this handout up front if anybody, and a couple other ones if anybody wants to come and grab them afterwards. But the longer term health effects of untreated hearing loss. So if you're wearing hearing aids, you're giving your ears and your brain that stimulus, you're treating it, untreated hearing loss can really kind of wiggle its way into all aspects of our lives. So the first one up at the top there, that cognitive decline, adults with untreated hearing loss experience a 30 to 40% faster decline in cognitive abilities. According to McMaster's Optimal Aging Portal, Johns Hopkins School of Medicine has found that moderate untreated hearing loss increases the risk of dementia by 3 times, and it's more of a risk factor than smoking, obesity, and depression. So it is quite high up there, and is easily treated. Depression is a big one. If we don't hear well, it makes it very hard to participate in conversations and social functions. And those with untreated hearing loss have significantly higher rates of feeling isolated and depressed due to that lack of social engagement. And I always like to say, if you can't hear the punchline of the joke, it's much less funny. So you have to hear the setup, the punchline, all of it to really appreciate and understand. Then we kind of move into balance and falls. That same Johns Hopkins School of Medicine research did find that a mild hearing loss increases your chance of experiencing a fall by 3 times and continues to increase the chance the more severe that hearing loss gets. And then we do know that tinnitus is very closely linked with hearing loss. It's not causal, so it's not like you have a hearing loss, you're absolutely gonna have tinnitus. I see plenty of patients with normal hearing and have tinnitus, so they're very closely related, but they're not necessarily causal together. So quickly, how do you prevent hearing loss? And really the best thing to do is avoid those noisy environments or wear the appropriate hearing protection when you're in those noisy environments or doing those noisy jobs and hobbies. There are 2 common types of earplugs. These universal ones up on the top right, or the foamy ones that you can kind of roll up and push into your ears. They have a typical reduction of about 20 decibels. So that would mimic like a mild hearing loss. And they often kind of wiggle out or they don't fit quite right. They work great for some people, but some people just don't have the ears for them. So then we do also have custom-made silicone earplugs. So we take an impression of your ear canal and make them fit hand in glove. There's different styles. This one up on the screen is a full shell, so it's coming right up into the pin in there, but it can be nice and tiny for sleeping if you have somebody that snores beside you maybe. And the solid ones, they can be solid or filtered, I should say. This one you might be able to see there's a little hole right there, and there's often a filter in there. The solid plugs will attenuate about 27 decibels. So you're getting more attenuation with a solid plug, but those filtered plugs knock down the sound equally across all the frequencies, making communication easier. It doesn't warp the sound or distort it quite as much as a solid plug would. And then they're often more comfortable, and they can be made in different styles and shapes for you, and particularly good for sleeping next to a noisy partner. So I thought we would go into the parts of a hearing test here. By a raise of hands, how many people have ever had a hearing test done? Wonderful. So we like to start with a comprehensive case history. And really what we're trying to do is get to know you and your hearing needs and where your hearing is falling short for you as an individual. So we like to find out your family history of hearing loss and the amount of noise exposure, because that helps us understand any potential hearing, the pattern of hearing loss that we find. They kind of go hand in hand. And this is important to get a full picture of your hearing health and understand how your hearing has been declining or potentially why. By narrowing down your primary hearing and communication challenges before we do the test, we're better able to understand why those might be pain points for you and provide an in-depth explanation of how your hearing thresholds might be affecting those day-to-day pain points. So, another little participation, you can close your eyes if you want to, but these are the main pain points or areas where we like to evaluate when trying to understand an individual's communication challenges. So if you read through them quickly there, how many of you would say you experience or have a loved one who experiences at least one of these pain points? I certainly do. So the first, once we get all the background information on you and understand why it is that you're coming to us for a hearing test or why it is that you're exploring your hearing health, that helps us understand the test results and relate them back to you in understandable terms. Next is video otoscopy. So these are my eardrums here. The little camera goes in your ear and we are able to see the ear canal right down to the eardrum. That's as far as the camera goes. So you can see that we have good visualization of the whole eardrum here. Good cones of light, if I do say so myself. They're in the right positions and there's nothing bulging or retracting and it's nice and dark in behind. So that is what a normal healthy eardrum looks like. If we do not have any visualization of the eardrum, mostly due to wax, occasionally foreign object, but 9 times out of 10 it's earwax, we do need to get the earwax out before we do the hearing test because it will provide something called a conductive component to your hearing loss. So if we can't see the eardrum at all, we call that fully occluded. If we can see some of it but not all of it, partially occluded. And we do need to remove it so that we can see the full eardrum because our first test that we do after we take a look in your ear is a little pressure test, which I'll talk about in just a minute. So, oh good, it moves, okay. We do wax removal first and foremost. If you get a hearing test with your ears full of wax, it's gonna give us wonky results and unreliable results. So we do use a couple different techniques. Curetting, which is kind of gentle scraping or scooping to roll that ball of wax out. Irrigation, which is a warm water flush. There's nowhere for the water to go but back out the way it came. So we flush that water through, nice and warm body temperature, and it gets out all that wax, or a little aspiration or microsuction to pull out those pieces for you. It's a very satisfying experience if you do have a wax buildup, both for myself removing it and for you having it removed. To be totally honest. We do use natural oils and hydrogen peroxide to kind of manage the earwax. The oil is going to soften and loosen it, make that removal nice and comfortable and easy. And then the hydrogen peroxide can be used to dissolve small amounts of wax in between flushes, or if it's too close to that eardrum and I can't get in there with the suction, I'm going to say let's use some hydrogen peroxide. It's a nice safe way to get rid of the little bits in there. And then I have here, unlike Shrek, none of us produce enough earwax to make a candle, so no worries. So that little pressure test I was talking about, once we get the wax out and we've got a nice visualization of the eardrum, we do something called tympanometry. And what that does is it establishes the condition and movement of the tympanic membrane as it responds to changes in pressure. So when you go flying or up Highway 6 and your ears pop, that's your eardrum managing the change in pressure for you. Once we, sorry, I already said that. Like we saw in the beginning of the presentation at the video, the eardrum vibrates and moves those 3 small bones. And the information is passed on to our cochlea. So the tympanometry is a test with simulated pressure to measure how the eardrum is responding to those changes and will give us an idea of your middle ear health. So we visually check the outer ear, and then we use this pressure test to check the middle ear. It is painless, I will say. Then we get into the guts of it, the pure tone threshold testing. So once we've established there's no blockage in the outer ear and we've tested the functionality of the middle ear, we can move on to what people really think of when they think of a hearing test, those beeps. Beeps and repeat after me. So the pure tone audiometry or threshold testing is conducted in a soundproof booth with insert headphones to ensure the most accurate results. First, we start with air conduction. So we're going through that outer ear using our middle ear and hearing with our inner ear to determine the severity of the hearing loss. This tells us how you hear at each frequency in a quiet environment using your entire hearing system. Then we will test your bone conduction. So what that is a little bone oscillator, like a headband that goes on you, and it sits right behind your ear on your the back of your head there, and we're skipping your outer and middle ear and only testing your inner ear. So that gives us the information of where in your hearing system your hearing loss might be happening. If both of the bone and the air conduction show a similar pattern, we call that a sensory neural hearing loss. So you're hearing the same whether it comes from your outer ear, goes through your middle ear, and reaches your inner ear, or if we skip outer and middle and go right to inner. If those are both similar, it's classified as sensory neural. If there is any mismatch in that, there's two different possibilities. If we have normal bone conduction, so your inner ear is hearing normally, but your outer and middle ear show a loss, that's a conductive hearing loss. One of those potential, like if I did it without removing the earwax from your ears, your inner ear would be hearing a lot better than your entire hearing system. Could also be perforated eardrums or those little bones, those ossicles. They can disarticulate or be affected by things like osteoporosis and stuff like that, so it can make that passage of sound deteriorate. If there is both a loss in the bone and the air, but they look different, the bone is less severe than the air conduction, we call that a mixed hearing loss, a revolutionary name. They're both deteriorating, but they're a little different. And that's really the three types of hearing loss. We have sensory neural, conductive, and mixed. So this next slide is an audiogram here with the levels of severity. So we've got the horizontal axis is your frequencies or your pitch. So it's like a piano. You've got your low tones on the left, high tones on the right. Typically we test from about 125 to 8,000 hertz. That is the communication, certainly not the full range of human hearing, but that is really where the communication frequencies lie. Our speech frequencies specifically are about 1,000 to 4,000. And then looking at the vertical axis, we can see the loudness in decibels. So the higher you are on the graph, the better your hearing is. That's the quieter range. Up in that normal yellow spot there, and then 120 decibels, very loud, like a siren or an alarm or something like that. And I've got some example audiograms here. So all the way on our left side is normal hearing. So you can see those thresholds are kind of bouncing around, but they're all up at the top there. I believe her lowest is 10 decibels, which would be like hearing raindrops on glass. That's a 41-year-old female with normal hearing sensitivity bilaterally. Right in the middle is what I would call a classic presbycutic hearing loss. We've got normal hearing in those low frequencies, and then it slopes right down into profound in those higher frequencies. So again, we're losing clarity before we're losing volume. And that's an 82-year-old male. And then this third one over on the right is actually my grandfather's hearing. And he's got noise-induced and presbycutic hearing loss kind of coming together. He was a carpenter, and it's showing a severe sloping to profound sensory neural hearing loss there for him. So that is all our beep testing completed. But beeps are helpful, but we don't communicate in beeps, so we have to do a little bit more. So then we go into our speech testing. And the first one we have up there is the most comfortable level, your MCL. And that is important to us because it gives us kind of a baseline on where to start for other speech testing, and gives us an understanding of how you like to hear. Do you like things a little bit louder? Are you more sensitive and you prefer it to be quieter? So it gives me an idea of where you're at and where you're comfortable listening. Second one is your speech reception threshold, your SRT, and that is the quietest volume that you can correctly detect a 2-syllable word in a quiet environment. So in that soundproof booth, how quiet can I make the words before you lose the ability to tell me, repeat them back to me? Then we've got our word recognition score, our WRS, and that is telling us how well you can recognize a 1-syllable word when prompted with a little phrase. So the computer says, say the word dog, say the word kite, and you're repeating that last word back to me, and it's really, can you hear that last word, 1 syllable, you've got 1 shot at it, and we do that at a couple different volumes for you as well. And then we've got the speech and noise testing, or our quick SIN, which determines your signal to noise ratio, which is really the #1 complaint that I hear coming in is, I can't hear when there's background noise. As soon as it gets loud, I lose all the clarity and my ability to sort that sound. So that's a very important test for us to understand how you're hearing in those noisy, more complicated environments. Then, we've got another video, so before I press play, I'm going to pull this out for you.
Tinnitus is sound without an external source, but where does it come from? Let's go inside the ear. Sound moves down the ear canal and vibrates the eardrum and earbones. Those vibrations then arrive at the cochlea, where rows of hair cells react to incoming sound energy. It's here in the cochlea where tinnitus often begins. Loud sound exposure can damage hair cells, creating dead regions. The lack of sound stimulus from these regions can create a feedback loop in the brain, triggering a ringing sound. The spontaneous firing rate increases, leading to a chronic uptick in activity in the auditory cortex. That's tinnitus inside the ear.
Okay. There we go, we're back. So, how many people, raise your hand, have experienced tinnitus or tinnitus throughout their life? Quite a few. And we've all probably had that experience when you go to a loud concert and your ears are ringing for the next day or overnight, but it eventually dissipates. And that's quite normal. It's your auditory system kind of recalibrating after being exposed to such loud noises. But tinnitus or tinnitus is when it sticks around and it's there all day, every day, can be very bothersome, can really fade right into the background. So it's different for everybody. It's considered a phantom sound, so you can hear it, but nobody else can hear it. There's no external sound source. It can also come in many different sound types. So it can be ringing, humming, chirping, hissing. Some people hear crickets, some people hear clicks. So it's very different for everybody. And it's really quite common. There's 38% of adult Canadians report having tinnitus in the past year. So just like in this room, quite a few of us have experienced it, whether it be short-term or permanent. So there are many possible causes. Like the video explained, that high-frequency hearing loss can certainly contribute to tinnitus rearing its ugly head, so to speak. So when the brain no longer receives that high-frequency information due to a high-frequency hearing loss, it almost generates that pitch itself, resulting in that ringing or chirping or clicking. One-sided hearing loss or asymmetrical hearing losses can contribute to tinnitus as the brain is receiving different amounts of stimulus from each side and it's struggling to process it equally, and that can cause stress on the brain that you might not necessarily feel in your body, but it's working overtime to try to make sense of all of that, can result in that tinnitus sound. Ear wax is a big one. If your ears are fully plugged and you're not hearing your outside world as well as you usually do, you might hear that inside tinnitus sound a lot louder because you're not experiencing that external sound source that you're used to. Drugs can be a part of it as well. Prescription drugs such as aspirin or antibiotics in excess are shown to increase the likelihood and intensity of tinnitus. And stress and anxiety is a big one. They're very closely tied to or tinnitus, I should say, is very closely tied to our general or overall well-being. So people often come to me or just in general report that if they have a big life change or a traumatic experience, their tinnitus spikes because their body is in kind of a fight or flight, and it generates an increased intensity or an onset of that tinnitus. And then we've got alcohol, caffeine, and salt. They're fun, but they're not good for us. They're also not good for tinnitus. And unfortunately, there is no cure for tinnitus. Because we don't know exactly what it is that's causing it, we can't pinpoint a cure. But there are good treatments, two of which I'll talk about. TRT is tinnitus retraining therapy, and it's a habituation-based therapy designed to help individuals cope with tinnitus by reducing its perceived impact on their lives. So it combines directive counseling and sound therapy to help patients habituate to the sound of tinnitus and reduce its associated distress. And then we've got sound or acoustic therapy, which is distraction-based therapy using an external sound source, like a sound machine or hearing devices, to distract the brain away from that internal tinnitus sound, using the external sounds and having it focus on that instead. And then we've got treatment options. Unfortunately, there are no dietary changes. There are theories, but really the mainstay of hearing loss treatment is a hearing device or a hearing aid. They come in a broad range of styles, as you can see here, and their technology levels and value points. Technology level is really talking about that computer chip that's inside the hearing aid and that's doing that sound processing for us. Today, the newest technology uses two different chips. One focuses on speech amplification and clarity, and the other chip is focused on managing that background noise. So this is a huge advancement from having one chip trying to do both those jobs to be able to, a small little hearing aid, be able to support two chips and have each of them do their separate jobs. The difference between the technology levels, I talk about them on a good, better, best technology level, is really how automatic and adaptive those hearing aids are, or how smart they are, is a very easy way to think of it. The hearing aids are how the hearing aids function in more complicated environments, like parties and in the car, goes up. They get better with the higher level technology, and then pricing is based on that technology and not the form factor. So all of these hearing devices look the same, but they could all very well have the exact same chip in there, and they would then cost the same. So let's go through a couple different options. We've got the behind the ear hearing aid. That's a bigger one. It is a power hearing device that's fitted on individuals with severe to profound hearing losses. These individuals often prefer more power for their awareness and require greater amplification. They're called behind the ear because the speaker is sitting behind the ear. So it sends the sound through a tube, like you can see there, and right into the eardrum. They are coupled with mold, like you can see, it fills his ear. Those molds don't have to be that big, but they can be a full ear shell or right in the canal. Then we've got the most popular, which is the receiver in canal hearing aids, or RIC hearing aids. And they fit a wide variety of hearing losses, from mild to severe, depending on the type of coupler that you have with them. So this type of hearing aid is very discreet and comfortable. They're called receiver in canal because unlike that behind the ear, the receiver or the speaker is sitting right in your ear canal. So all the sound processing is happening behind your ear, sending it through to the speaker that's sitting right in the canal for you. RIC hearing aids are great for high frequency clarity losses as they remain the most natural sounding with an open fit. So what I mean when I say open fit It's a minimally occluding dome. So we've got it up on the top right there. You can see there's nice big holes in it. And that keeps your ear canal open, so you're hearing those frequencies that you do hear well, you're hearing them naturally, and then your internal sounds, like your chewing, your own voice, your breathing, are able to escape out your ear canal like they normally do. So it makes for a very comfortable, natural fit, and it really depends on the type of hearing loss that you have, which type of dome is going to go on the end of the hearing aid for you. Then we've got some people's favorites, the custom fit hearing aids. They are appealing to many people because of their discrete in-the-ear form factor. There's nothing over the back or anything. And it works really well for people who are maybe consistently changing glasses or still wearing masks or have an oxygen system. So anything that can kind of bog down the back of the ear, we can keep that free by using a custom fit hearing aid that sits right in the ear. This works well for people who have both a volume and clarity hearing loss, so both low and high frequency loss, as it occludes the ear and seals in that amplification. So no open fits with a custom hearing aid. They are, all of that technology is sitting right in your ear canal, which is gonna plug up that canal. An individual with only high frequency hearing loss will often find this style kind of boomy and echoey because of that occlusion. Because those sounds are getting trapped in the ear canal and kind of bouncing between the hearing aid and the eardrum. So that is all of our hearing testing, hearing aid part, and I just wanted to give you a little insight into Hearing Well Matters, our clinic. So we are an independent full-service hearing clinic located in central Burlington. We're just up and around the corner. I think I have the 2 points. So we are at the Art Gallery, and then there is Hearing Well Matters, just up the street there. So we offer a free hearing test, hearing device sales, service, repair, wax removal, tinnitus assessment and treatments, and custom earplugs, everything we went through today. We do have 2 testing booths, so we are able to do 2 tests simultaneously. Works great for spouses, also great for best friends, in my opinion. And that's pretty much everything I have for you, so I'm excited to answer some questions, see what gaps I might have left in here. Oh, I definitely did cover everything.
I just wanted to ask what the cost of custom earplugs would be roughly.
Sure, yeah. At our clinic, they're $395 for the pair. That includes the impression and the construction of the earplug, and then we do have the manufacturer that we use is very generous. We have 90 days to make any changes to those. So once you're fit with them and you take them home, you can practice or try out sleeping with them, go to work, that sort of thing. Lots of time to make adjustments. Yeah.
There seems to be a hearing aids every corner that we go through. What should I be looking for in terms of the quality and insurance that I'm going to have the best test I can possibly have?
For sure. So I think that, absolutely. There are lots of hearing aid clinics, lots of options to go to, and how do you know if you're going to get a reliable quality test? So I think keeping in mind the basic steps that I told you here today, particularly if you feel like you're plugged up, or if you see your own eardrum and there's wax in there and they're like, let's do the test anyway, that's a little red flag. I would say, just like everything today, reviews are very helpful. I kind of skipped past it. Toot my own horn, we do have 300 5-star Google reviews, so I find that a lot of people are using that to kind of gauge it, and that's my advice to friends and family that can't come to me, they're in other places. Look up the reviews, the patient reviews, and see how other people are talking about how their appointments went and how their treatment went. Yeah.
Does this hearing test take into account the Munson curve, where in a certain range of hearing, like around 1,000 cycles, people don't hear there, but they hear otherwise?
For sure. So when we do the hearing test, we're going to test you from 125 hertz right up to 8,000 hertz. So in that 1,000 range there, we're going to test all of those frequencies, and we're going to find the quietest beep that you're able to hear and respond to at each of those frequencies.
So then the hearing aid would be designed to compensate.
Correct. So we use those thresholds from that pure tone hearing test to program the hearing aid. So if you have better hearing in your right ear than your left ear, that right hearing aid is going to work a little differently than that left hearing aid. Yeah.
Hearing aids can be very expensive.
Mm-hmm.
I think it's important that you mentioned that Ontario will pay a portion.
Absolutely.
And your own personal health plan will pay a portion as well. So I think people need to be aware of that.
Yes, let's run through that quickly. That's a good idea. So we do have, in Ontario, we're very lucky, we do have a provincial grant through the Assistive Devices Program, that ADP. Same thing if you're getting a walker or a cane or anything like that, or a wheelchair. Anything that's going to assist you goes through this program. They will pay $500 per device. So if you have a one-sided hearing loss, you're gonna get $500 from that Ontario government. If you have a bilateral loss, it's $1,000. And then also, like you said, any private insurance or health benefit plans often have an allotment for that as well. So something important to look into either before you come or after you find out that there is a bit of loss, definitely worth a phone call. Absolutely. So Marian asked, can you insure the hearing aids? So hearing aids typically come with a minimum 3-year manufacturer's warranty and a 3-year loss and damage warranty. So should you lose them, step on them, flush them down the toilet like my grandfather did, you do have protection. And then once that expires, I have had a couple patients put it on their like home insurance and stuff like that. Yeah.
I have a different question of sorts. Friends who have had hearing tests complain about the pain that they suffer. And they
During the test?
3 or 4 people at least told me that.
Oh,
What
heavens.
would cause such a thing to happen?
The only thing that I can think of would be, I have heard some people, we do one test called the UCL, your uncomfortable level, which is nobody's favorite test, but it's about how loud can that beep get until it's like almost painful. The other thing is if it would be physical discomfort, it might be something like a wax impaction that then if they put that insert headphone in, it's pushing against the wax, which is pushing against the eardrum. I'm not sure, I've never had anybody complain of painful hearing tests. That's new to me, but hopefully it's not happening too often.
I've had a few friends who won't wear them, they've got them, because they say that ESH or they're irritating all the time. Can you be allergic to them, or is there a solution to that?
Absolutely, yeah. So the piece, yes. So the itching or the ear, like if you, I think you said you have a couple friends that have gotten them, but they don't wear them consistently because they're itchy or uncomfortable in the ear canal. And that can be like an allergy or just kind of a personal preference of not liking things in your ears. We've got different domes, like we talked about there, that open and the closed. Those are silicone, so they are, they shouldn't be an allergic reaction to that, but if that is the case, we've got different options. We can do an acrylic mold, we can do titanium mold, stuff like that. So there's lots of different couplers, as we call them, that fit in the ear to make sure that it's not irritating or tickling or anything like that.
I came to see you a couple of weeks ago because I thought I was having a hearing problem, and what it turned out to be was a lot of wax. And I want to let everybody know here, I've never been treated so well by a medical professional, and I've gone to quite a few over the years. You're fantastic.
Oh, wonderful, thank you.
Hi, thanks for your informative talk. I have something a little bit different, and I'm just wondering in your practice if you've seen this. So I have acoustic neuroma, which is benign on my left side of my ear, so it's a benign tumor on the nerve. In your practice, and we
not a huge number, but we certainly have had people with an acoustic neuroma. So it's a benign tumor on the auditory nerve that affects your hearing. And it can be different for everybody. Like sometimes it affects you more, sometimes it affects you less. But what I would suggest is something that we do offer is demonstration hearing aids. So we have you in, we do a full hearing assessment with you, and then I can set you up with a pair of hearing devices and let you try them in your real world for a couple of weeks. See if you get that benefit. Go ahead.
In those situations, is it usually a unilateral, one hearing aid, or two for an individual?
Really depends. So it might be that is it unilateral or bilateral? So that's what the hearing test will tell us. Is it only affecting that one side, or is it affecting that one side more and you have a little bit of loss on the other side? And then again, if you just need the one hearing aid, we do the one. If it's two, then the hearing aids do work together. So even if it's a severe loss on one side and mild on the other, I like to put two hearing aids on because they work together and help you sort the sound and understand your awareness a little bit better.
Sorry, and one other question I meant to ask with the microphone. Hearing tests are free.
At our clinic, they are free for anyone born before 1984.
Hi, actually, I was a patient of the clinic, and I was gonna say the same thing, that it was so calming and just very relaxing to go there. Rob was easy to talk to, and so were you, and so it was a wonderful experience.
Wonderful.
I also had the acoustic neuroma and had the surgery, and what happened was they went in to get the thing out through my ear, so there was no hearing at all. So you never actually talk because it doesn't happen often, but it's a Bluetooth thing.
Correct.
Yeah.
The cross system. Yeah.
So sometimes I wonder if it works, then I realize, hey, yeah, I did hear that, so I guess they do work.
Very good. Yeah, that's another type of hearing system that we don't see too often, but if we have a dead ear, so to speak, or one ear that is not giving us a lot of information, but one ear that has mild, moderate, severe, workable hearing loss on the other side, it's called a CROSS, C-R-O-S, contralateral routing of signal. So what that's doing is you're wearing two devices. Say I can't hear on my right side, the transmitter is picking up my right side sounds and sending it to my good ear on my left side. So you're still getting that full awareness, but it's all going to your one better ear.
I have two quick questions.
Okay.
When would you go from in the ear to an over the ear hearing aid? And also, what brands of hearing aids do you deal with?
Absolutely. So, quick and easy, what brands of hearing aids do we deal with? We are an independent clinic, so we're able to dispense any of the the 6 main hearing aid manufacturers, which is really nice. And then the in the ear versus the over the ear really depends on things like manual dexterity and lifestyle. That form factor is, so the manual dexterity of how are you able to get that piece correctly behind your ear and then the little piece in the ear, or is it easier for you to grab one and just put it right in? And then also what your hearing loss looks like, what's gonna be more appropriate for how you're hearing. So it really comes down, we need to do the hearing test and then kind of evaluate your lifestyle.
Okay. I know a lot of the hearing aids now are with current technology, so they would connect to an app. And so just, again, for this crowd, if there's any fear or uncertainty about how to navigate that, could you talk a little bit about the app that goes with some of them and how to work that?
Yes. So there are remote controls that come with hearing aids quite often. And either it's a dedicated device that comes from the manufacturer of the hearing aid where you're able to change the volume and the programs and all that good stuff, or if you're a tech-savvy smartphone user, we can connect it to an app on your phone and then you use your phone for the those same functions, volume control, program changes, all that good stuff. Depending on the type of phone that you have, it's quite likely that we can also use them like wireless headphones, so that phone call, you pick up the phone call, it comes right into the hearing aids, so you're not using the speaker or trying to hold the phone up to your ear, you're hearing it bilaterally in both ears, and then the hearing aids are actually picking up your voice and sending it back. So you're able to walk freely around the house and enjoy your phone call with just by using your hearing aids.
I just want to make a comment. I have eczema of the ear, and I do wear bilateral hearing aids. But what has helped is 1 day a week, when I'm going to be at home, I leave the hearing aids out and I have a cream to use, and that seems to solve the problem.
For sure. And I will say a little bit of natural oil is really a good way to moisturize our ear canals. I like to suggest doing it before you go to bed, so it has time to kind of absorb and do its thing overnight, and then you're ready to put those hearing aids in the morning.
How often should you change hearing aids?
So, how often should you change hearing aids? The typical lifespan of a hearing device or a pair of hearing devices is about 5 to 7 years. Really depends on how well you're taking care of them. I know I have some patients that come in and pull them out of their pockets and put them on the table. Some people, my grandfather, for example, is quite rough with his hearing aids. So 5 to 7 years is kind of our standard lifespan, and the technology is coming like every 18 months to 2 years. We're getting new technology and different options. So I would say you get those 3 years of warranty, you get that government grant every 5 years. So between 3 and 5 or 3 and 7 years is where we typically see people upgrading. I do have one patient who is wearing 14-year-old hearing aids and she loves them, so that's fine too, as long as they're working for her. Oh, did you mean upgrading because of the technology changes or because your hearing has changed?
I'm not sure, but they are in their 6th year, so I'm having some difficulty.
Yeah, so that's a good point. So as your hearing changes throughout that lifespan of the hearing aid, our rule of thumb at our clinic is about once a year we'll test your hearing. So as your hearing changes, we're reprogramming those hearing aids so they're appropriate for that hearing loss that you have. So if you haven't had a hearing test in a while, that might be one route, but there is 6 years, so 2019 to 2025, there have been huge leaps and bounds in technology, so it's something to explore.
Very quickly, I just want to say I saw Meredith a couple of weeks ago for a hearing test, and she was great.
Thank you, I planted that question.
I have 2 questions. My husband years ago had hearing aids and he stopped wearing them because it built up wax so quickly, like within 24 hours.
Yeah.
What do you do for that?
What do we do? So, that's a tricky one because the hearing aids, just by the nature of what they're doing, is they're blocking up that ear canal. So I would say that would be kind of a combination of giving him the tools to manage that wax on his own, or that might be where that hydrogen peroxide comes in. So it's a little bit kind of dissolving that wax a little bit over and over again type of thing. That would be my first step, but definitely lots of options.
Okay. It's a moot point now, but I've heard of other people who complained of the same thing, so I just wanted to ask that question. Second question is, if you've gone to one hearing aid clinic and you've got your hearing aids and you're not entirely satisfied with the service, I'm kind of a loyal person, but how do you go about changing?
How do you go about changing? So, if we say Marion got her hearing aids in Mississauga and now she's moved to Burlington and it's not feasible for her to go to Mississauga for tune-ups and changes. What often hearing clinics will do is do a file transfer and then put you on kind of like a program of care type of thing. So we would request that file from the previous clinic so we get all the background, the dates and warranties and previous hearing tests, and then we take over your care. Often comes with a cost that can range from 300 to 500 depending on the clinic. And that is quite normal, happens all the time, that we kind of adopt people who have moved into the area, or we're sending the result, like our information, because our patients have moved away. So loyalty is good, but if it's helpful, if it's nice and close by and it makes your life a lot more convenient, I'd rather you ask me for all your test results and stuff and I forward them on and you start a new relationship that's convenient and helpful for you than having to trek back and forth to come see me.
Question for you. What causes wax to be built up?
Really depends. Everybody's a little different. So some people, I like to say, I'm the middle child of 3 siblings. I have no earwax. My older sister has no earwax. We gave it all to my little brother. So it really depends. It also often the shape of the ear canal as well. A very straight ear canal is going to be able to remove that earwax or have that flow a little more naturally. If we look at our ear canals from like a bird's eye view, they do have a bit of an S shape to them, and it depends on how sharp those bends are. Where it bends, it gets narrow, and that's where the wax tends to accumulate. But the amount that you produce is really just dependent on your personal makeup, yeah.
At what point, or do you recommend people to have a cochlear implant?
That is a little outside of my scope, but there is good criteria to whether or not that's going to be helpful for somebody. It's a big decision to make. So very often that is an ENT or an audiologist that's making those decisions for you. We don't deal with cochlear implants, yeah. How do you determine candidacy for a cochlear implant?
You mentioned the government grant every 5 years.
Mm-hmm.
I was under the impression that it was every 3 years. Is that something that's changed recently?
So automatically every 5 years. Between 3 and 5 years, we can apply for like an early replacement for you. So there is a way to get it after 3 years, but automatically everyone is eligible every 5 years.
What is the difference between an audiologist and a hearing specialist?
Very good question. So, in the hierarchy, we've got our ENTs, our ear, nose, and throat otolaryngologists up at the top. They're the surgeons and the specialists. Then we've got our audiologists, which is a master's or a doctorate, and they are able to treat children and older adults. So that's the main difference. I am a hearing instrument specialist, so I work with over 18. So I don't treat or fit children with hearing aids. That's really the main one. Yeah, we do very similar jobs, but I am strictly adults. Adults. Yeah.
Oh, yeah. Is there any service that you provide that somebody would need a referral for, or can anybody just contact your office for any type of hearing test or service you provide?
Very good question. So we do not need any referrals. We often do get doctor referrals, but a self-referral will work just fine for anywhere from earplugs, earwax, hearing test. We welcome everybody to come on in and get a baseline to start and see what the results are.
Meredith, Paul has an awful lot of problems when he's talking on the telephone, picking up what other people are saying to him. Is there anything that he can do, or is there any device that is available so that we do not lose that interaction with both?
Are we talking landline?
Yes,
okay,
landline.
Yeah. So one thing that I like to mention with landline phones is where you're hearing from. So typically we're hearing from our ear canal, and that's where we've learned to hold the phone. But with hearing devices, you're actually hearing from up here, where the microphones of those hearing aids are. So if you hold the phone down here, the sound is getting blocked by that receiver that's in your ear. So if you shift that phone up a couple inches, that might get the sound from the phone going right into the microphones. They don't always sound the clearest. It depends on what the other person's got going on as well. I know I have one patient drives him up the wall. His son calls him when he's like on speakerphone in the car, and it's I have trouble hearing that. So I know I've been trying to. I don't know, how do you tell your son don't call me when you're driving? But I mean, it's kind of a lifestyle change, and there's certainly lifestyle changes for those with the hearing loss and wearing the hearing aids, but also adjustments to be made for the friends and family of that individual as well.
Most hearing aids have batteries. They can be difficult to put in or maintain. Is it an extra cost to switch? I heard about rechargeable. You just put your ear plug on a rechargeable, which is so nice. Is there a cost to switch over?
So you would need to purchase a rechargeable hearing device. So it would be, if you're currently using a disposable battery operated hearing aid, it would be upgrading your technology to that rechargeable tech. But I would say 9 times out of 10 in 2025, if you're gonna purchase a set of hearing aids, you're given the option. Do you want that rechargeability? We still have those battery operated ones for people who are quite comfortable with that. But going forward, I would say the standard is gonna be that rechargeability for you.
How much more expensive is it?
Same price. Yeah, so that is a built-in feature, just like the Bluetooth, that sort of thing that comes standard with it. If that's the option that you want, we can go either way, but same price, yeah.
I was told you can't switch to rechargeable if you already have a battery one.
So,
unless you have 5 years.
right, so if you're wearing a battery operated hearing aid, you would have your trial period where you can switch back and forth. But once you're out of that trial period, it would be buying new technology.
I work with seniors as well and looking at aging well, and a couple of times, and one of those is obviously checking their hearing. A couple of clients I've had end up with tests that show that they do have hearing loss, and the families have noticed it and brought it up, and that's why they went for the test. But even after being tested, they still feel like they don't have any hearing loss. Do you have a test or something that they can do when you're with you that can show them what they're missing?
For sure. So one of my favorite ways to kind of demonstrate that with concrete, tangible proof, so to speak, is that word recognition score test. So what I will typically do is I will place it at their most comfortable level that they've told me. So you've come in, you've told me 60 decibels sounds great to me. Then we run through that test that the man says, say the word kite, say the word dog, that type of thing. How do they do at their most comfortable level? And then how do they do at a normal hearing level? Or if they don't do very well at their most comfortable level, I turn it up a little bit, and then they do much better with it a little louder, and that's kind of demonstrating what that amplification can do. So if they're getting 60% at 55 decibels, but then I play it again at 70 decibels, and all of a sudden it shoots up to 100, that extra little bit of amplification is making a big difference in their ability to recognize and repeat those words. And that's often quite a helpful tool for patients to see. I find that it can be very funny, but a lot of them are like, oh, I thought for sure, the examples that I have are a little bit rude, so. like say the word witch, you can let your brain elaborate from there. So that I find is one of the more powerful parts of the test is hearing or seeing how they do with the same set of words but at 2 different volumes.
And do you find sometimes that isn't still successful though, in a sense, like that they're still...
Like that they're still in denial afterwards? Of course, yes, yeah. And I've got people with very mild hearing losses that are ready to go and treat that mild loss and they love the hearing aids. And then I've got people with very severe and profound hearing losses that are sure they don't have a problem and they hear everything perfectly. So everyone's a little different. So, go ahead.
A question related to when you have your hearing aid connected to your phone, when you go elsewhere, do you have to be connected to the Wi-Fi there,
Sure, yeah, good question. So the way that the hearing aids are connecting to the phone is through Bluetooth. So you could be out in the middle of the woods and have your phone on airplane mode or up on an airplane, and that connection is still going to be there. So you don't need service, so to speak, and you don't need Wi-Fi, you just need that Bluetooth connection between the hearing aids and the phone.
If I purchase a hearing aid from you, what kind of follow-up do you offer and what price do you charge?
Sure. So with our clinic, we have bundled our service and our devices. So you're paying once for those that hearing aid and your service right at the beginning when you're fitted with them, and then as long as you're wearing those hearing aids, I'm happy to take care of it for you. So you're not paying per appointment when you come in for follow-ups. I like to see you about every 6 months just to check in, give them a good clean. If you're a waxy person, I like to check your ears, that type of thing. And then, like I said, I like to check your hearing about once a year. So every other time, and then any time in between, you give me a call and we'll fit you in the schedule. We can typically see you within a couple of days, certainly within the week, and make sure you're taken care of.
What can you do with hearing aids that are no longer needed?
You are welcome to bring them. I'm sure any clinic would do it. We certainly do take donations at Hearing Well Matters, and we either send them back to the college for students to learn on, or back to the manufacturer to be potentially reused in like third world countries and stuff like that. Yeah.
Oh, right here. I blame it on my height.
I've got 2 questions. How often is wax, just plain wax, the problem? And number 2, are people generally happy with the hearing aids? Because I hear so often that people get them, that it doesn't make much difference in a crowded room and all that.
Yeah, so wax being first and foremost the biggest problem is probably, I would say it's like probably 50-50. It's certainly a compounding factor. So even if you have a mild hearing loss or a moderate hearing loss, if you've got ears full of wax, it's going to feel much worse than it actually is. So I do have a lot of people that come in and see me, I take the wax out and they're like, oh, my problem's solved. Even though we've done a hearing test and it shows that they have hearing loss, it's enough of a difference that they feel comfortable with just getting the wax out. And then, sorry, what was the second question again? Oh, yes. People, it really depends. So everybody's a little different, and I think that fitting the appropriate hearing device is a big factor in patient satisfaction. So if somebody doesn't want anything behind their ears, but their hearing test leans toward a behind the ears style, it's really managing my expertise of what that's going to be like, and then what they want type of thing. So I've got a lot of people that try those custom fit hearing aids because they're worried about the cosmetics of them, but they try them out for a little bit and then they're like, oh, they sound boomy, they're not comfortable, that sort of thing. Then they go to that behind the ear and they love them. So it really depends, and I think that follow-up care is very important as well. So I like to track my patients down and make sure that I'm seeing them pretty often, because if there's a problem, I can't help you fix it unless I know about it. So I know that a lot of people will some are very happy to give me a call and let me know and book an appointment, and then some people will wait until that 6-month follow-up and say, oh, it's been 2 months and I haven't been wearing them because A, B, and C, and those are all things that I could have fixed 2 months ago type of thing. So I think the follow-up care is a big part of it, and then selecting the appropriate hearing aid. So it really is, we call it like a 3-legged stool. So the patient has to be ready and willing to wear those hearing aids and let them work for them. I have to be pretty good at my job, and hopefully I am, and then that hearing aid device needs to work as it should. Yes, so the hearing aids have gotten better at managing background noise. Like I said, those 2 separate processors, now we have a whole processor that's dedicated to that. But it really comes down to, if you have normal hearing in those low frequencies and then it slopes off, like that middle picture that I had there, that person is going to hear noise, no problem, just naturally how their ears are. So there's only so much that a hearing aid can eliminate before we're compromising amplification and stuff. So it's a bit of a balance. It's not a perfect solution. It's not going to return your hearing to like you were 20 again, but it is the best option that we have right now.
So YouTube
Absolutely, yeah. So it goes through, not like physically, it used to be like a screwdriver that I would have to do many moons ago, but now we connect them up to the fitting software. They are amplifying each frequency appropriately based on that hearing test that we did. The patient would do minimal changes, like I would set a base level, and then that patient would be able to go up and down from there, change programs for noisy environments, quiet environments, that sort of thing. So there is a certain amount of personal control, but also when I set them up for you and send you out, if you just put them in and wear them like that, they're working how we want them to.
Here, I have a question for you. So over the years, I've experienced clients with cognitive decline and the struggles that they then have with their hearing aids. Is there any hearing aid that's better than another for managing with somebody that has some cognitive decline? Because what I find is that they get frustrated and they won't put them in, and then it makes dementia much worse.
Yeah. So what we have found is a custom fit hearing aid with a little, it's like a almost fishing line, like a little loop on it. That can then be, like something can be attached to that loop, a little clip that clips onto the shirt. So even if they get frustrated halfway through the day and they pull it out, it's just hanging there. So it doesn't go missing, it doesn't get stepped on or anything like that. But really getting them in is the other part of it. So it really depends on the person, but I would say the custom hearing aids with a physical loop attached that can be then attached to your clothes is typically what we would offer or dispense to somebody in a memory care or something like that. Yeah.
I'm curious about branding. What are the leading 2 or 3 brands of hearing aids, and what countries do they come from?
Sure, yeah. So GN Resound is from Denmark. We've got Phonak from Switzerland. We've got Widex, which is American. Oticon, also Swiss. And I always forget that third one, or the 6th one. We've got Phonak, GN, Oticon, Widex, I said. And then they're all kind of umbrella too. So there's Unitron, but that falls under Phonak. But those are, like, there's 6 main manufacturers, and we are able to dispense from any of them. So I often get, if somebody comes in and they've been wearing Oticon hearing aids for 10 years, I'm not gonna switch them to a Phonak hearing aid. I'm gonna keep them in that Oticon family because they've gotten used to how that product sounds, how they work, they're comfortable with it. Each manufacturer does process the sound a little differently. Some focus more on power, some focus more on organic or natural hearing. So it really depends on if they have a previous relationship with a manufacturer. I typically stick with that. If not, it depends on the needs. If it's more power-based or clarity-based, that sort of thing.
Sorry, it's just a little tip. So my mom is elderly, she's 95 and a half, wears hearing aids in assisted living, and has got cognitive mild impairment. What we found helpful was to actually, for staff, because staff can change, is showing them how to put it in and taking a picture and sending it to the neighborhood coordinator or lead nurse. The other thing to prevent loss, because my mom would take them out, put them in her glass case, put them in her purse, put them in her pocket, was actually getting them charged. The rechargeable is fantastic in the nurses
Like
area.
the nurses station,
and
yeah.
then they put them in and take them out.
For sure. So that's another thing for memory care individuals or people who need a little bit more assistance, removing them from their personal space and kind of leaving it to the staff to take them out and charge them overnight and then put them in the morning is very helpful. Okay, last one. Okay.
Just one more. Waterproof.
Hold the mic to your mouth. Hold the mic to your mouth.
No, the whole thing.
Waterproof.
Yes.
I unfortunately am in water a lot. I swim, and occasionally I forget to take them out. They still work, but I'm not sure
Sure.
how often.
How often does that happen? Yeah. So the hearing aids are water resistant. Like every hearing aid is water resistant. There is one waterproof hearing aid on the market. It is the Phonak Life. And other than that, I have seen them go through the laundry. I have seen people jump in the shower. I have seen them jump in the lake, go swimming, that sort of thing. They're really quite resilient. But I would say if you were my patient and they were within warranty, I'd say give them to me, let's send them to the manufacturer, have them take it apart and check for any water damage, and then give them back to us so we just know that everything's smooth sailing for you.
Starkey, is that one of your brands?
Yes, that's the other one, Starkey.
Nice.
Okay.
Let's go.
Take your time, that's a long Oh.
Well, thank you very much. Did anybody learn anything? Actually, I'll ask you, one person, tell me what is the most important thing you're gonna take home?
Getting hearing test.
Hearing test, I go to Meredith. I guess that would be the second. Okay, so thanks very much, Meredith. That was a great presentation. So this slide is, as you know, it's always up and plan for the future. So it's, I guess it's the same thing. Nobody's expecting to lose a hearing or have problems, or your partner has some challenges, but I think your message is also to be proactive around taking care of it. And also in terms of the quality of living and the things that you're missing. You don't know what you're missing when you're not hearing. So as always, this session is being videotaped, and I will send out an email with a link to the recording, but you can always find all the past sessions, with the exception of 2, on the Empowered Senior Speaker website under the past events tab. So they're all there. So when you have nothing better to do, you can spend hours and hours and hours and hours. What did we say, 28 hours now? So keep you busy for a while. Thanks again to all our educational partners. They're all great contributors and much appreciated. If you haven't had a chance to meet them yet, please do take the time. You never know when you're going to meet somebody between us all. If we don't have the services here, we certainly know someone who can help you. Next session is September the 10th. I always get that date wrong when I'm not on the slide, but this one I'm pretty sure is right. It's always the second Wednesday of the month. So September the 10th. The next session is about what it's really like to downsize. So we'll have real people who've gone through it, experienced it, and will share the good, the bad, and the ugly. So it's a good session to attend. You can RSVP for that. And also a reminder, please just fill out your evaluations. Those will come in very handy, will be very helpful. And once again, thanks very much for joining us.